Bye.
Good morning. Today I'm going to talk about the healthcare systems and medicine globally and in Panama. Even though the medicine around the world is constantly developing and finding new cures to strange and new diseases, despite this, most countries around the world don't have access to this kind of quality of medicine. Most people believe that the United States has one of the best healthcare systems in the world and the medicine in the world, but that's not entirely true. Actually, according to the World Health Care System, United States occupies the 37th place in the world in health and medicine area, while the two actual best countries in the world are France and Italy. On the other hand, Panama occupies the 95th position in the world in healthcare systems and medicine. Despite this, Panama's medical healthcare system has more faults than pros. However, the country with the worst healthcare system in the world is Myanmar, which is an Asian country near Thailand. The service and quality of the medicine has its roots in the education they receive. Most of the education in medicine is located in the best universities. Located between UK, United States, Canada, Sweden, and some Asian countries. A consequence of this is for the people that cannot afford to study outside their country and don't have the economical resources to have at least a good education. So, which leaves them with a very low knowledge and education and a very basic knowledge of medicine, which leaves them behind on the new information, the developments and researches of medicines. This leads to a country, and this leads the country to have a low knowledge in medicine, medicine service, healthcare programs, and being underdeveloped in the health and medicine area. Some of the countries that are underdeveloped in this in the health and medicine area are mostly African countries, some Asian countries, and slightly Latin American countries. As I have said before, the country with the worst healthcare system and medicine in the world is Myanmar. In Myanmar, the government spends between 0.5% and 3% of their economy into their healthcare systems, which leaves a population with a life expectancy of 50 years, with the part of the population under 15 years old. Another African countries like Malawi suffer the same situation, where there is hardly any healthcare system and medicine in the country. In Malawi, the life expectancy is until 54 years old, and the average age of the population is 17 years old. In Malawi, the HIVs and the AIDS are concentrated to their health, in which 68,000 of the deaths, causes of the deaths are because of this. In a 15 million, in a population of 15 million people. Other African country is Liberia, where only 4.7% of the population is over 16 years old, and 43% of the population is 15 years old or under. In Liberia, malaria is also a constant threat to their health, in which in 2010 over 9 million cases of malaria were reported. This is a high number and overwhelmed the small healthcare system that they have, where 43% of the children that are under 5 years old don't receive an anti-malarial vaccination. Another country is Angola. In Angola, the life expectancy rate, mortality rate is among the highest in the world, and life expectancy rate that they have is still low, meaning that most of them will die before they turn 5 years old because of malaria, diarrhea, respiratory infections and bacteria, and malnutrition. And now, even though Panama is in the 95th place in the World Health Organization, the healthcare system in Panama has more faults, as I have said before, than pros. One of the faults is that in the security the social security centers are understaffed, meaning that the staff has a very basic knowledge, that anyone could have that knowledge. And other problem is that over the 4 million people that Panama has in their country, the only public hospital is Santo Tomas, located in the capital. Given that not all the population lives in the capital, and some of them live in rural areas, this is a problem because the ones who live in rural areas cannot have access to the right they have to have a healthcare system, to have a healthcare and medicine that they need. For example, for the people that live in rural areas, one of the challenges that they have is that since they live far away and the social security centers that we have are far away and cannot treat some of the diseases and sicknesses that they have to make an appointment with the doctor, call the doctor, and at least 1 to 3 months before the appointment, and have to travel days before the appointment, and when they get there, they have to wait 3 to 6 hours to finally see the doctor, which is ridiculous. Another problem that we have seen this year is that the ambulances are taking long to arrive to places that they need to arrive as quick as possible. As I have said before, we have seen this year when a man was hit by a car and the ambulance took 2 hours to arrive to the crash place. When they arrived, the man was already dead. And also, my personal experience with ambulances is that the staff is almost, the knowledge is not that the knowledge that they should have is very basic, and they're under, they don't have the knowledge that they should have given. Now the pros of the healthcare and medicine in Panama. In Panama, we have what is called medical tourism, which is what private hospitals do to get money, which means like people come from another countries and buy these huge rooms, like suites, and they live like, while they're staying there, they live like they are in a 5-star hotel. We can see this in Hotel Punta Pacifica and Hotel Nacional, Hospital Punta Pacifica y Hospital Nacional de Panamá. these are the suites that they have in the hospitals, and this is called medical tourism because they also can bring doctors from their doctor from their country, which gives money to the hospital and gives money to the government. So basically, it's a win-win in every part. Also, Panama has the 37th place in the worldwide in life expectancy rate with a 4.77% of life expectancy rate, and it's pretty good compared to another Latin American countries. So we can say that in Panama health has some pros, in which means that the mortality rate is low and the life expectancy is higher than most of the countries in Latin America. So we can say that health is good, but the service that they give and the service that they have has many faults. In conclusion, some challenges that we have is that the epidemiologists, the healthcare systems are understaffed, and they should have paid more to them. And some solutions that I will give is promoting health and preventing diseases, keeping people healthy. Prevention is the best way to help the country rise when it comes to mortality rate and life expectancy, because at the end of the day, without the population, we don't have nothing. So this is my solutions, and I hope you like